This portion of CardioSource Video News is brought to you by Medtronic.
For CardioSource Video News, I'm Dr. Randy Martin. One of the most fascinating and really revolutionary developments in the last few years has been the concept of treating severe aortic stenosis with a catheter-based valve. The PARTNER trial looked at this in patients considered to be inoperable, and its goal was to determine whether the transfemoral implantation provided better outcomes than traditional therapies. My colleague, Dr. Peter Block, was one of the lead investigators and joins us now. So, Peter, what did the trial show?
You're right, Randy. The long-awaited results of the PARTNER 1 trial have just been released. Now, the PARTNER 1 trial is a complex trial, but this portion of it is only for non-operable patients with aortic stenosis. 358 patients, non-operative candidates, randomized to ongoing medical therapy or standard therapy, including balloon valvuloplasty versus transcatheter valve implantation of an aortic valve, or TAVI. Now, the important issue is what is the mortality of the procedure. It turns out at 30 days, the TAVI patients had a mortality of only 6.4%, less than 10%. That's an extraordinary number for these very sick patients. Now, the endpoint was really all-cause mortality at 1 year, and that's where the striking difference really comes in. Patients treated medically, including balloon valvuloplasty, as I said, had a mortality rate at 1 year of 50.7%, whereas TAVI patients had a mortality of only 30.7%. Most of that mortality was due to other comorbidities, not their aortic stenosis, which of course was TAVI, has been taken care of. Now, in addition to all-cause mortality, the combination of all-cause mortality and repeat hospitalization was reduced from 72% in the standard group to only 43% in the TAVI group. And New York Heart Association class 1 or 2 was only 42% in the standard group, but rose to 75% in the TAVI group. And lastly, there was no deterioration of valve function over 1 year, no increase of paravalvular leak or aortic regurgitation, however you want to think of it. So these are extraordinary results, much better than anticipated, and probably will change the way we think about taking care of patients with inoperable aortic stenosis in the future.
Peter, is there a downside to the use of these valves, such as excessive bleeding or vascular complications?
Well, Randy, you're right. These patients do have an intervention. Number one, that causes the early mortality of 6.4%, but more importantly, because they have cut downs, because they have something done to their femoral arteries for insertion sites, they have more bleeding, more transfusions, and because this valve is placed through the proximal aorta, there is an increase in stroke, 7% in the TAVI group. Now, the stroke business is an important one. It's been glossed over, sort of, in surgery in the past and balloon valvuloplasty. It's been in the range of 2 to 3%. But now, I think interventionalists and cardiac surgeons are going to have to address this issue of stroke and see how we deal with it as we intervene on our patients. But this trial is a breakthrough trial, extraordinary results, and will change the way we think about taking care of patients.
Medtronic proudly introduces Integrity BMS, now available in the U.S. Visit MedtronicStents.com for more information.